Hello, Facebook family. My name is Dr. Joy Ward, and I am here to talk to you about your children's teeth. Now, for the past few months, we've been talking about, or for the past couple of months, we've been talking about teens and adolescents. So we've covered diet, we've covered how teens are a little bit different from the infants that we talked about. We've talked about their how they brush a little bit differently, and because their habits are different, they eat more fast food. We talked about whitening. We talked about bleaching, which is something that's kind of a lot on the minds of our young people, and so we've talked about all that. I want to thank Miss King. Thank you, Sandra. You always come, and I appreciate it. And Miss Lawson. Hey guys, thanks for coming to join me. But we talked about all that stuff, and it's just important for you to know that there's a big difference between kids, between infants, and between our adolescents and teenagers. Today, we're going to talk about something that's really important, something that's really near and dear probably to all of us. And it's something that it's probably not at the forefront just because we're dealing with the COVID pandemic. But today we're going to talk about tobacco use among our youth. And it's been kind of pushed to the back because there's so many other things that are going on, the pandemic and so many political things. But did you know that North Carolina is actually a flagship state of where tobacco use is a little bit higher than the national average? Yeah, just because we're in a state where tobacco is grown, tobacco is generationally used. And so what we're finding is that the statistics in North Carolina are much higher than they are nationwide. For instance, this was very staggering. In North Carolina, almost 36% of kids use e-cigarettes. That's vaping. And that is such a broad topic that we're not going to even talk about that today. But tobacco is a big problem. 5.6% of middle schoolers, and that statistic blew me away. Middle schoolers, I'm talking about 6th, 7th, and 8th graders, are using tobacco. Some of it is smokeless and some of it is vaping or smoking tobacco or cigarettes. But kids are also in the habit of using pipes. And I'm talking about like pipes, which I thought only older people would use pipes. But kids are using pipes. They're using different kinds of tobacco. And it is all devastating to our children. Studies show that 98% of kids who start in their teenage years will continue that habit on until their adulthood, until it possibly causes a problem. We're going to talk about some of those problems in a minute. So the teen and adolescent age is really crucial when it comes to making sure that not just their teeth, but their body is healthy. Remember that smoking is linked to heart disease, high blood pressure, lung disease, different types of pulmonary issues, as well as diabetes, obesity, and other health problems like pneumonia. And we also think that there's a link between smoking and the COVID pandemic that's now going on. And so kids are learning about this stuff really early. And so it's really important that we talk to them about that. It's also important that you know that smoking or secondhand smoke can also be very detrimental to your child. So this encompasses not only just the kids who smoke, but the kids who are around the kids who smoke. So again, this is a big problem. One of the reasons why we think that vaping is on the rise is because they are flavored. That's right. Vaping is flavored. So they have like bubblegum flavored vaping or punch or watermelon flavored vaping, which makes it more appealing to our children and not necessarily to older adults. So it's important that we understand more about that, and we're going to talk about that next time. Today, I just want to talk to you about the detrimental effects of tobacco, period. 6% of kids use smokeless tobacco, which is actually down from where we were. So 2019 statistics show that smokeless tobacco, or chewing tobacco, or dipping as they call it here in North Carolina, is detrimental to kids because, of course, that is directly linked to oral cancer. Throat, mouth, tongue, all of that is detrimentally affected by smokeless tobacco. It should interest you that the ones that are more at use for smokeless tobacco are our athletes. And so as early as 21, children who begin to use smokeless tobacco when they're 14, 15, and 16 can develop cancerous lesions. So it's not something where you gotta wait until they're 40 for them to use smokeless tobacco and have cancer and problems and other lesions and stuff like that. It can happen as early as 21. Now, it's important for you to know that not only are there systemic, which is their heart, their lungs, and then we're talking about cancer, we're talking about all those kind of things, but tobacco use, period, no matter what kind, can also affect your gums. It stains your teeth, and of course it causes you to have a smell in your breath, and it also affects the flow of your saliva, such that there are some studies that think that obesity is directly related to the way that smoking dilutes your digestion and your digestive system. And so smoking is just really bad news. Now, what do we do about that? Well, first thing I suggest is that you talk to your kids about it. That's right. Even though we know that smoking is not a good thing, and we know that it's out there and kids can do it, it's really important that you just say something to your children. The second thing I'm going to recommend, if you smoke, consider stopping, because studies show that not only do you put your child at a higher risk, but generational smoking is one of the top factors of why kids smoke. So those two things. Talk to your kids about tobacco. And then number 2, if you smoke, you quit. Now, I know that was real serious, but believe it or not, we have more stuff to talk about. So join me in 2 weeks, and we're going to talk a little bit more about vaping. We're going to talk a little bit more about the process of smokeless tobacco. We're going to talk about pipes. We're going to talk about nicotine. We're also going to talk about other drugs that are smoked or inhaled and that can adversely affect not only your teenager or your adolescent's teeth, but also their whole person. So on a good note, I want to invite you all to be a part of our scavenger hunt. Now, if you haven't heard about our video scavenger hunt, go over to the Facebook page and look it up. And we want to challenge you to come on and have some fun with us and be a part of it. Also, if you come in during the month of March, we will give you a free umbrella. That's one umbrella per family. We have beautiful purple and green umbrellas, totally free, just by keeping your appointment. And then lastly, if you make an appointment at the last minute, which is 48 hours or less, we will actually give you a free zoo ticket. How cool is that? So we want you to enjoy the zoo. We want you to be protected from the rain. And we also just want to make sure that your children have healthy teeth. So I want to thank you guys for joining me. Thank you, Miss Lawson, and thank you, Miss Sandra. I appreciate you guys joining me today. But I hope you guys stay safe, and I hope you have a wonderful evening. Take care now. Bye.